Now, you may be thinking that medicine was less sophisticated then, less technological, less advanced, and that is why it was affordable in 1940 without insurance. However, weren't automobiles less advanced, telephones less advanced, computers less advanced? How is it that they became more advanced, more powerful, more life-enhancing, yet did not become unaffordable for the average individual? Well, if you're asking these kinds of questions, great, you should. And you should want to discover the answers. First, let's discover the genesis of employer-based health care and its consequences, and then we will return to the technology question and see if we can answer it. In the early 1940s, FDR recognized that there would be fewer employees available for employment at companies due to the war. Employers would have to increase wages to entice workers to come to work for them. In an attempt to eliminate the consequence of rising prices and inflation, FDR chose to institute a wage and price freeze. Of course, dictating a wage freeze doesn't change reality. The reality was that, in fact, we did lose workers to the war effort. Therefore, employers were faced with having to entice them. But they couldn't raise wages. So they started using employee benefits, particularly health benefits, to attract workers. This became quite attractive. By 1942, however, the IRS caught up with this and determined that this was really a substitute for wages and wanted to tax it. Political pressures were applied to Congress by lobbyists, particularly from the unions, to preserve this tax exemption. In 1943, the IRS issued a ruling confirming that employees were not required to pay tax on the dollar value of group health insurance premiums paid on their behalf by their employer. As you will see, this single health policy decision made by the IRS will have tremendous ramifications, and it was probably made without understanding the fundamental principles involved. First, let's be clear on what a tax exclusion really is. It is not only free of federal and state income tax, it's also not taxed by FICA, which today constitutes Social Security and Medicare amounting to over 15% for most employees. When this is added to the state income tax, which ranges from 0 to 10%, and federal income tax, which ranges from 10 to 35%, we can actually get a 25% to 60% reduction in the cost of health insurance if you have it purchased by your employer. Well, what does this ruling say in principle? If you are personally responsible for purchasing your own health insurance, you have to pay maybe twice as much. However, if you let someone else be responsible for your health insurance, it's a better deal. This policy discourages personal responsibility in favor of a form of group responsibility by the employer. Now, is there even a deeper understanding of the cause of the problem? What was the power available and to whom that resulted in the discouragement of personal responsibility? To help consider this, I'd like to take a quote from our first president. Quote, "Government is not reason. It is not eloquence. Government is force. Like fire is a dangerous servant and a fearful master." George Washington, 1797. Here, Washington recognizes that fire as our servant heats our homes, cooks our food, and enhances our lives. Government force as our servant protects our rights and our property. But like fire, when out of control, it can destroy the things we value. Viewing the events in this way, we see that FDR utilized the force of government to dictate the wages that private employers will offer private citizens to work for them. The consequences of that use of force is that employers still had the reality to face of lack of workers. They responded by offering health benefits. What Congress did next was to put into law the incentive to get someone else, namely your employer, to be responsible for purchasing your medical care, by not using the force of government to tax you if your employer pays for it, but using that force to tax you if you choose to pay for it. No other particular fact you discover about health care finance or health insurance will alter this fact. When you recognize this principle, discouraging personal responsibility by the use of government force, no other subsequent facts will change it. In this way, you know you have reached something at a fundamental level. When we also recognize that all ideas have consequences, then judging this idea becomes important. If discouraging personal responsibility is a good idea, we could expect constructive consequences. If it's a bad idea, we can expect destructive consequences. I believe it's wrong and immoral for a government force to be used to discourage and penalize personal responsibility. A simple way to understand this is to consider a parent's role in raising their children. Do you teach your children not to have personal responsibility? When they need something from others to support their life, do we raise them to expect to have it given to them by others without earning it? Is that the goal of parenting, or is it precisely the opposite? We teach them to take responsibility for their actions, and their first goal should be to take care of their own life. We raise our children from the standpoint of being responsible individuals who can go out in the world, earn a living, raise a family, and respect the rights of others as they do those things. And yet, we are using the full force of government to discourage that principle in the realm of medical care. Any reform idea that does not recognize this and address it will not cure the problem and all the problems that have resulted from it. That job lock and portability is a result of this more fundamental issue. In our analogy, portability is the symptom, and the disease is government force being used to discourage responsibility. Now, did the market respond to this? The answer is yes, the market did. Consequently, most individuals have their health insurance purchased by their employer. Today, only 4% of health insurance policies are privately owned. Now, with this understanding of the issue, how would you address the portability problem? Well, our politicians treat portability as the problem. They develop laws like COBRA to allow employees to retain their employer insurance for only a limited amount of time after they leave a job. But this solution ignores all the history that we just reviewed and never addresses the discriminatory nature of the tax code that penalizes individuals that choose to be personally responsible for their health care. What's the real solution? How do we cure this disease? Simply allow any individual to have the exact same tax exclusion for the money they choose to spend on their medical care, for their medical insurance, or for self-insurance vehicles like medical savings accounts. Addressing this at the root, like treating TB in our example, will not only cure the symptom of portability, but will eliminate many other symptoms that we've not even discussed. Now, this solution does not require tearing down the current employer-based system. It only offers to the individual the same tax advantage status for them to own their own policy instead of their employer. This is not just the practical thing to do because it will work. It's the right thing to do because it's morally right to stop using government force to discourage personally responsible behavior. This will likely result in the gradual transition of individuals purchasing personal and portable health policies and begin to invigorate the market for individual policies. Now, we've spent a lot of time covering the symptom of portability to understand the diagnostic process. For the next symptoms, I'll move more quickly. What about employers that don't offer health insurance? This is often perceived as a problem. Yet again, it is a symptom of the same discouragement of personal responsibility in the tax code, and also of a subsequent American psyche that developed from it, that medical care is someone else's responsibility. The proposed solutions only offer more government force. Force all employers to offer insurance. Force all individuals to own insurance. Force employers and employees through penalties and taxes to pay for a public option. All these ignore the cause dating back in 1942. Now, before producing more mandates, regulations, new entitlement programs, our government should first offer the same tax exclusion to each individual. But now I hear the complaint that medical care or medical insurance is too expensive for most individuals to buy, even with a tax break. So this is the last symptom I want to cover, the high cost of medical care and medical insurance.